So good morning. Thank you for joining us on the Marianne Gebauer podcast. And I am joined by Dr. York Hsiang. Thank you, Dr. Hsiang, for joining me today to chat.
Morning, Marianne. It's great to be here again.
So, Dr. York Hsiang, this has been a big week. You are speaking on behalf of the judicial review that's going on in the BC Supreme Court. You are a former UBC professor of surgery, former vascular surgeon at VGH Hospital, and now you're embroiled in a judicial review that is challenging Dr. Bonnie Henry. Can you bring me up to speed on what has happened this last week?
Yeah, I'll be happy to. So much has happened. Maybe what I'll do for those who have not been following this very carefully, we have just finished 2 weeks of being in the BC Supreme Court as a group of petitioners. There are 3 petitions involved against Bonnie Henry, represented by the Attorney General's office. And so what has happened in the first week is that our lawyers, and so we have a legal team of 2 lawyers and an articling student who come to the law courts every day. Plus, we have another lawyer who is residing not in Vancouver, but is in attendance every day. Plus, we have a solicitor behind the scenes. So we have a big legal team that has been in court for the last 2 weeks. In addition to that, the third group of petitioners, since our lawyers represent 2 groups of petitioners, one group is us. And so we're the doctors and nurses. The other group are a group of nurses who also have religious reasons as to why they did not take or observe the mandate. And the third group of petitioners is represented by the JCCF lawyers. And again, they're a group of healthcare administrators, nurses, and doctors, and they have a different complaint. So what happened in the first week is that our lawyers went first for the first 2.5 days, followed by the JCCF lawyers. Then at the end of the first week, what happened was that the JCCF team is represented by 2 lawyers. Unfortunately, one of their lawyers was sick and not in attendance at all. And so the Attorney General's office, in other words, the government, seek to, an adjournment or seek to prolong it. And basically by saying, let's wait until the other JCCF lawyer is healthy and hear all of her complaints before we would proceed. And in other words, they wanted to extend this for at least another 2 weeks. What it really means is that they needed that extra time to actually respond to our oral submissions, which our lawyers complained about. They objected to it. And I would say gratefully, the judge agreed with our side. And so we were to continue this week. And so what happened this week was that the Attorney General or the government's lawyers have been in court presenting their counter arguments to our arguments since Tuesday to Friday. And then on Friday, our lawyers had the opportunity to reply to their issues. And so it's been an interesting time because whatever we have said, the Attorney General's office has tried to discredit that. And I can give you a number of examples of how they have tried to discredit it. In our reply, the judge disallowed probably about half of the comments in our reply. And the reasons is because when the Attorney General's team was up and they were discrediting us, how they discredited us was that, first of all, I would say, the nasty word is smeared. Probably the more polite term is discredit. And so they attempted to discredit all of the petitioners in our lawsuit, including myself. And so when it came to discrediting me, basically their comment They recognized the fact that I had been a vascular surgeon for 34 years, professor of surgery at UBC. The way they discredited me was essentially he's 67 years old and he is now retired. In other words, he's an old guy. And so we moved on to the next person. The next person was, in fact, one of our physician members who is both a family physician and practices child psychiatry in a very high-risk group of adolescents who are prone to have suicidal tendencies. And the way he has been doing that is that he's on a contract, but he has been doing all of that work virtually. They discredited him by saying that even though all of his work was done virtually, it is possible that at some point he may have to come into the hospital for a face-to-face meeting. So because of that, the PHO was justified in firing him from his contract. Besides, he still has his private practice and he's doing okay. The way they discredited the third petitioner, and the third petitioner is a registered nurse, 27 years experience, the charge nurse for a small hospital, well, medium-sized hospital in BC. And the way they discredited is that, well, she managed to find another job. It's in the film industry, not in nursing, but she's okay too. And so I was amazed that they would be so blunt in a tactic, and so that was quite surprising. Now, when they because our suit is really over two issues. We're asking the judge to rule on the reasonableness of, number one, that there is still an emergency in British Columbia, which allows the provincial health officer, gives her all these powers to do all these things to all of the unvaccinated healthcare workers. And number two, is it still reasonable to keep unvaccinated healthcare workers who are likely the healthiest and probably highly experienced out of the workforce at a time when all these mandates have been dropped in Canada, around the world? And so their response to it was actually kind of like trying to hoodwink the judge. Number one, when you're talking about is there still an emergency? And so in order for the provincial health officer to declare an emergency, they have to fulfill 2 of 4 criteria. And in the 2 of the 4 criteria is this term called regional event. And so it struck me that nobody has a definition of what an emergency is. Similarly, nobody has a definition of what a regional event is. And so they were using terms like catastrophic, never happened before, unpredictable. It's kind of like atmospheric storm. Terms like that on the face of it sounds horrible, and you think you really know, but in fact, because there is no definition for it, you don't really know. And then they introduced, and they didn't really introduce it. This is what is actually written down. These are the requirements. There has to be in a regional event, at which point our lawyers pointed out a regional event is really declared by the regional health officer, not the provincial health officer. The provincial health officer is actually overstepping her responsibilities by interfering with the regional health officer. In other words, if it's in the VCH region, then the VCH health officer should be one making that declaration and not the provincial health officer. But they were arguing the definition of a health officer, and Bonnie Henry is also a regional health officer in addition to being the provincial health officer. And our side, because we already had our chance to say what we wanted to say, we said it's like she's overstepping her boundaries. But their counter argument is that, well, she is also a regional health officer for all regions. And then there is a term where if the provincial health officer deems something to be a health hazard, can call this an emergency. Well, the fundamental question is, what is the health hazard? By implication, are we, the unvaccinated, a health hazard if we went back to work? And that is what they were trying to portray. And so they struggled with the issue of an emergency. And I have some information to show you a little bit later on about how they tried to muddy up the waters in their description. In terms of attacking the unvaccinated healthcare workers, they were using cherry-picked data, not recent data, but data related to the previous Delta strains, where there are some papers that have said that number one, hybrid immunity, which they were really, glomming onto, was better than natural immunity. And then they would bring that argument forward and say that everyone in the hospital has had the primary series and has also become sick. And so they all have hybrid immunity. And even though hybrid immunity, at least the vaccine part of it, wanes after probably 3 to 6 months, and you have no immunity or lasting immunity from your vaccination, the vaccines were given over 2 years ago. By this time, there is no immunity from the vaccine. Your immunity is really your infection-acquired immunity. In other words, you basically are comparing natural immunity to natural immunity at this point. And so the way that they had altered things is that they have said the term waning effectiveness, of which the Attorney General lawyers actually, I suspect, do not know the term, what it actually means. And they're telling the judge what it means. So the judge is somehow, he's thinking, waning immunity. Does that mean you have waning immunity to infectiousness, duration of disease, recovery time? And they're saying, yes, judge, yes, yes, judge, yes, judge. But in fact, waning immunity is it just means whether you're going to get sick or not, right? It has nothing to do with how many symptoms are reduced or anything like that. So it's clearly a way of confusing the judge in these terms. And they actually, the Attorney General lawyers actually went ahead and said that, this vaccine-induced immunity never goes to zero. Even you have a little bit, but a little bit is better than nothing. So that little bit plus your infection-acquired immunity makes you better than someone who only has natural immunity. So that has been their argument. And so it has been very disappointing. And at some point, the judge was saying, well, he started to ask some questions, and in our reply, because we get the final reply, if you like, which is limited to maybe about a couple of hours, we tried to straighten up all of those inconsistencies and explain to the judge, about some of these things. But the judge accepted maybe only half of the comments that we put in for our reply. The others, which we had put in to try and clear up the error as to what has been said is not accurate. And he basically said that you are case splitting. In other words, you are re-arguing what you had previously argued. So a lot of that was not allowed. And hence, that's the way the week ended. I think that overall, I think our lawyers did a great job explaining our side of it. I think the Attorney General lawyers did a good job too of muddying the waters completely. And now it's unfortunately going to be up to the judge to make a decision. What is going to happen is that the JCCF lawyers are coming back on December the 18th, I believe, for maybe no more than a week in court. And I suspect the government lawyers will also get a chance to rebut at that point. I don't think the petitions are going to be separated. So I think that the judge will rule on all of the petitions together. And likely we're going to hear the judge's decision probably late January, early February next year. So that's what's happened.
So how do you think the judge will rule?
I kind of feel sorry for him, this is such a huge responsibility for the judge. And as I was in the courtroom, I was trying to imagine myself being the judge and thinking about what will my decision be? And so I was wondering, how do judges go into this? Do they basically like stick their fingers in their ears and they blah, 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 they don't listen to anything. So you go in, you're completely unaware of this. And so it's like, well, give me your arguments. Let's hear your arguments. Let's hear your arguments, and I'll make a decision. Or are the judges like regular people, and it's unavoidable, that you hear about these things. Perhaps it's unavoidable that you've heard of somebody that you know of. Let's say there's been vaccine injured as a result of this. Does that impact your ability, or do you try and keep that completely separate? Because I think this is the dilemma for the judge. The dilemma is, if I rule in favor of the unvaccinated healthcare workers, let's say we say that the emergency is over and bring back the unvaccinated healthcare workers, how will it come back and bite me if there's an outbreak of disease amongst the unvaccinated healthcare workers? I don't want that on my career. I'm not going to do that, Or let's say I rule against the unvaccinated healthcare workers. If the judge was, let's say, not living in the Lower Mainland or Victoria, and in fact lived in Northern BC, and he would understand more completely about the problems in our healthcare system and the hospitals, the smaller hospitals in Northern BC, where you have no staff, you're closing everything. If he rules against the healthcare workers, is he only accelerating the decline in healthcare in BC by keeping these otherwise experienced healthy healthcare workers on the sidelines? And so he could rule a third way. He could rule that the emergency is over, and I'll leave it up to the PHO to figure out what they want to do. Perhaps the PHO will say, okay, it's over, but the decision to keep the unvaccinated healthcare workers out, she's going to delegate it to the hospitals. It's up to them to figure out what they want to do. So, I feel the judge is it's a difficult situation. This is a hugely important case. Being argued not on constitutional reasons, but being argued in the sense that, did the provincial health officer, has she overstepped her responsibilities in calling this an emergency at this point, and is she justified in keeping the unvaccinated healthcare workers out, really at a time when our healthcare system is it seems like it's a perpetual crisis. You have heard reports today of cancer patients. They feel that the number of cancer patients going to the US for their treatment, number one, is not enough, because the government had anticipated sending 50 patients a week, whereas they've only sent 12. And the number of patients still needing cancer care, by sending the patients to the States, you have not made a dent in the number of cancer cases. And so there is no good news, for the government regarding healthcare. I don't know why they insist on keeping the unvaccinated healthcare workers out. We raised the issue that the WHO, has long said that this pandemic is over, and the government lawyers actually admitted to the fact that Bonnie Henry previously had worked for the WHO, but at the same time, she does not need to follow what the WHO is doing, and yet equally she gets a lot of her information from the WHO. So I don't know. I think this it's ideology is what's happening, and I feel sorry for the judge that he's put in this situation. And he has to rule on a very, very important case.
It is a very important case, but it's an unusual case because if you look at the rest of Canada, all the doctors and nurses are back. So what makes BC an exception? So dangerous.
That's right. That's right. So the let me explain some. Let me share with you and your viewers some of my observations on why this case is so difficult to argue overall. First of all, it's a judicial review. In other words, there is no cross-examination of expert witnesses, of the petitioners like myself. And I understand that in other provinces, when you have a judicial review, number one, you have more than one judge. You can have you can have three judges, an odd number. And number two, you are allowed for cross-examination of your expert witnesses. And so maybe this is kind of a budgetary issue in BC that they don't allow that. But it is what it is. The other aspect of it is that because it's a judicial review and you cannot rely on expert witnesses, essentially you have lawyers, because the judge is a lawyer as well, or essentially lay people talking about medicine. And it's like literally the blind leading the blind. Without an expert witness to basically explain the whole set the whole scenario for you, you have lay people trying to educate other lay people, and it's been very frustrating. And so very simple terms like infection, transmission, infectivity, incubation periods, the terms that when they use these terms, they are not using it according to the way that it's recognized medically, is what I'm saying. And so everyone, has a different idea, and they're trying to explain it as a different idea. And that is very frustrating to actually listen to. The other aspect of it is that when you are, and I can understand why the judge says, I'm not going to rule on science, because really there is no science behind all of the studies. And what I mean by that is that science is the pursuit of truth. It is not the truth. And so you can get closer to the truth if you have scientific articles that are the least biased, right? Because if it's biased, your conclusions are going to be wrong. And so the best studies to eliminate bias are the randomized controlled trials. And essentially, after the drug-sponsored randomized controlled trials were stopped prematurely, because these are all experimental treatments, remember, and they were stopped prematurely to allow the controls to receive vaccines. So you have broken that separation, and everybody is now vaccinated. There is no pure group of unvaccinated people. So when it comes to the question of, number one, unvaccinated healthcare workers, how do they compare against vaccinated healthcare workers? There has never been one study that has ever done that. There has been billions of dollars spent around the world on vaccines, but nobody has done the study to pursue the truth in all of this. And so because you don't have a randomized controlled trial to actually answer that question, you have a whole bunch of scientific articles using a non-randomized style design to try and answer the question. And the problem with virtually all of those studies is that they are biased. And the way that they are biased is, number one, the majority do not examine healthcare workers. Majority are examining population of people which in our case may be kind of interesting, but it's not really relevant. Because in the population of people there, including very young people to very old people, the healthcare workers are in that middle group. So, number one, it doesn't really apply to us. Number two, it's not randomized. You have the experience of the very young who largely don't get sick. And if they do get sick, they recover very quickly. And you mix it with the very old who are more prone to get sick and the more seriously sick. So depending on how many young people versus how many old people get into those studies, it's not a direct comparison at all. So the actual relevance of all that is, in fact, completely irrelevant. But those are the best studies, or they're not the best. They're the only available studies that are published. The other problem with lay people, such as lawyers, is that, and they're arguing science or medicine in this case, they can't read or understand these papers. And so they can read a concluding sentence, perhaps, and the concluding sentence may be something either in favor of the vaccinated or maybe in favor of the unvaccinated. They do not understand the way that those studies were actually set up and designed. The majority of those studies, and they're quoting things like, "Oh, judge, if a paper has thousands and thousands of patients, it's true," and that is completely false because it's the way that the study has been designed. And so, if you have thousands and thousands of patients, but you're comparing not apples to apples, and the judge, I believe, recognizes that, then your conclusion will be false. And so, because media has been largely quiet, the effect in medical publishing houses is that they want to go with the flow, and the go with the flow means pro-vaccine. And so even if your study demonstrates that people with natural immunity is actually superior to people with vaccine or even hybrid immunity, because in order to get that paper published, they will need to actually put in the final sentence saying, but vaccination is probably the way to go, which goes completely against what their data actually shows. In other words, there is a massive publication bias in all medical journals that in order to actually get published, the authors have to put in that statement. So when it comes to the lawyers, they're only taking out that summary statement that vaccination is still the way to go.
So we were just interrupted. So we're back again with Dr. York Hsiang. And Dr. Hsiang, switching gears a little bit, but on the topic of data presented during this hearing, was there any compelling data that you would like to discuss?
You know, that's a great question. And I think your audience may be interested in some of the data that was actually discussed. And if I can just share my screen. Mm-hmm. Now, can you see that graph?
Yes.
Okay, so this is a graph, and it says 7-day average of COVID-19 severe outcomes. And you can see that it's in 3 different colors. Blue are the hospitalizations. Green are the critical care admissions, so people go into ICU, and the red are deaths. And so if you take each one of them at a time, you can see that the time period starts from, essentially starts from March 2020, and that's when Bonnie Henry declared that there is a pandemic. Now let's just look at the blue first, and you can see that the blue goes up and down, but really peaks around January 2022 or just after. And that is the Omicron peak. And that refers to people going to hospital with Omicron. And you can see that after that is kind of a jagged bunch of little peaks, but the overall trend is downwards to September 2023, where there is a slight bump up. But again, the trend after that, and which we have no data for, again goes downward. And similarly for the green, which is critical care admissions, you can see that it sort of follows the blue, except it's quite flat. No matter how many hospitalizations, the number of people going to ICU remains largely the same. And the same thing is also seen with deaths. And so this is the graph that was presented in court. And we have used it to basically show that there was a huge peak as a result of Omicron in terms of hospitalizations. But ever since then, the number of hospitalizations has been going down. There has been some ups and downs, just like any type of respiratory illness, but the overall trend is severely downwards. In addition to that, critical care admissions as well as deaths is largely very flat towards the second half of this. That's how we have presented the data. How the government's lawyers interpret this is that they are only focused on the right-hand corner of the graph, primarily, and I would say only, hospitalizations, where they say that there is an uptick in hospitalizations in September. And so the October order is that the pandemic continues, and we need to keep the unvaccinated healthcare workers out as a result in order to protect. And so that's the interpretation of it. And they're using terms like, if we don't do this, it will impact hospital capacity. And hospital capacity has been, even before the COVID pandemic, running about 110%. And by that, what I mean is that there are more patients coming to the hospital than the hospital actually has beds for. And so that results in things like hallway beds, very, very congested, long waits to get into the emergency room. A lot of that is, in fact, unrelated to COVID at all. And a lot of that is because of a description, if you like, called bed blocking. And by that, what I mean is that patients who are well enough to be discharged from hospital have nowhere to go. And that classification is called alternate level of care. At any one time, in any BC hospital, 20 to 30% of the hospital beds are blocked by alternate level of care patients. There's nowhere to go. They can't go home. What they need is they need long-term care, and there are no long-term care beds. So they just simply sit in our hospitals waiting for a long-term care bed to come up. Meanwhile, sick patients who come into the hospital, there's nowhere for them to go. They just have to wait. The other aspect of it is that hospital capacity, meaning hospital beds, is an issue of funding as well as primarily nursing staff. Funding, by and large, is not that much of an issue. The nursing staff is. And if anything, by keeping out, the official number is 2,000 to 3,000 unvaccinated healthcare workers, but probably the likely number is that you have let go 10,000 or so hospital care workers, because they took early retirement and things. That is what decreases your overall capacity in the hospitals. And let me show you another thing. So this is one thing that they've argued about. And if I can you see this? Is this a different diagram for you?
Mm-hmm. Yep.
Yeah. Okay. This is what they're talking about. They're talking about wastewater analysis, which is a new way of analyzing the amount of COVID in the environment. And so they're analyzing.
Okay, one moment. We still have the same chart up, right?
Oh, okay. All right.
Okay.
Let me just.
Can I just ask you a question about that last chart?
Go right ahead.
They made a case that there's an uptick in hospitalizations right now showing in September. But if I look back to September 2020, I look September 2021, September 2022, there's always been an uptick in September, maybe in the fall. So there's nothing extraordinary going on this September.
Correct. And that's what our lawyers are arguing. There's nothing really different than what is to be expected in a respiratory virus flu season.
Yes.
This type of thing, right? We just go to one other graph that they have bandied around, and this is the number of deaths. So do you see this? It says
It says deaths within 30 days by underlying cause of death.
correct. And you can see that there are three colors. There's a dark blue, and this is classified as COVID. You can see that there is a light blue, means as classified as non-COVID. These are the deaths. And you can see a gray, where it says the disease classification is still pending. So when this graph was presented, number one, you can see overall the total number of deaths by the combined height of the light blue and the dark blue, starting from, it looks like 2022 of April, going to October 2023, the overall trend is downwards. In September and October 2023, most of the deaths are still unclassified as yet. But if you look at the dark blue, these are classified as COVID deaths. From the left side of the graph to the right side of the graph, clearly what is you can see is that there is an overall trend is that it is downwards, right? So basically, what our lawyers have argued is that even COVID deaths over the last year or more has been going downwards. So because of this, these are government figures, using government figures to basically show that there is no pandemic based on number of COVID deaths. The government lawyers turn around and they then argue about the uptick in the gray on the right-hand side. They are basically trying to persuade the judge that the judge should consider all of these deaths hitherto classified as undiagnosed as all of them being COVID deaths. And so they are saying that there is an increase in COVID deaths, whereas in fact, they're unclassified. And if it follows the trend of the overall separation after adjudication into COVID and non-COVID deaths, it will undoubtedly, it'll come out that the majority of these were non-COVID deaths. And so those are just examples of putting up one type of data and having two different interpretations that are diametrically opposed. And so I can share with your audience wastewater analysis, and you can see that they have sampled in 5 areas, 2 in the Fraser area and 1 in VCH. So in Fraser, it's in Annacis Island, Northwest Langley. VCH, it's on Iona Island, which is Richmond, Lionsgate, as well as Lulu Island, which is also Richmond. And so you can see that what they are measuring for is they're measuring for evidence that there is COVID-19 in the wastewater, right? And so you can see the overall trend, in fact, in every one of these 5 communities is that the ability to pick up COVID in the wastewater is going down in every one of these communities. So what I've said is that our lawyers have used this to basically show the judge again that, look, judge, the government talks about wastewater analysis. This is their data on wastewater analysis. You can see that COVID in wastewater is going down in all of their samples. The flip side of it is that the government argues that wastewater analysis, so what they're arguing is that they're not arguing the data on the chart. What they're arguing is that wastewater analysis is a good way of following COVID. We continue to follow this. The provincial health officer uses all of this data to make up her mind about this. The provincial health officer has expertise in this area, therefore you must believe her. And so that's how the government argues this chart. And so anyway, so those are the 3 charts, you know,
Now that data is pretty hard to defend. Were they not a little bit horrified to see these charts come up? Because there's no compelling argument based on wastewater data that there's an issue. It just affirms your your case.
Well, in fact, if you look at all three graphs, and all three graphs are in the record, and the record is in fact provided by them. We have gone into the data that they have put in, and we have extracted this and said, this is your data. We are using your figures to basically show you that there in fact is no pandemic. All right. And so, we have to send this to them in advance. So that they have some time to consider a response, and then in court, and then we're arguing in an oral submission the exact same thing.
Mm-hmm.
And so it's interesting to actually hear the fact that well, maybe I'll segue a little bit into some of my observations, about what it takes to be a lawyer. And so,
let's take the screen share off.
Okay, let me take this off.
And then, yes, I'm curious to know, what do you think of lawyers? You've spent a couple of weeks observing.
Yeah, it's an eye opener, and I, for me as a doctor, I come from a different place. I come from a place of truth. When patients come to see me, I expect them to tell me honestly what's really wrong with them. And then I will go through and make a diagnosis, and I would tell them honestly what I really think is going on. Now, the art of medicine is telling someone bad news and how much you want to sort of roll out at a time. But, we're not going to lie. We're going to tell you what your problem really is. And so in a way, I thought that law would be trying to seek the truth in a trial like this. And it's really up to the judge to try and determine what is really going on. It seems to me that one side is trying to explain their truth. The other side may know about it, may feel that that is the truth. However, it's more important to win than to allow the truth to come out. And so I liken it to a football expression that was often bandied about, when they had Deflategate and Tom Brady and the footballs and things. And some of the commenters were saying, if you ain't cheating, you ain't trying. And so that's the sense I sort of have, and I think that one of the terms that was used very frequently throughout the 2 weeks of hearing is that your choices have consequences. And so when they're talking about the unvaccinated who chose not to receive a jab, well, that's your choice. But, you have to realize that there are consequences to your choice, which means losing your job, et cetera. And so, I also think at the same time that that can also be applied to the lawyers, because, your choice to be a lawyer representing the government also has consequences. I don't know how they feel, if they feel completely differently, but it's a job, it's a paycheck. And so they have to do their job to defend the government, even if they don't believe it. It's the amoral equivalency of a doctor who probably should have known better about the vaccines and went ahead and injected all his patients. So the scenario comes up in that, New Zealand, there were a lot of physicians who received exemptions that they themselves did not need to be vaccinated, but they turned around and vaccinated all their patients. And I think that's completely amoral. And probably you're just seeing the same type of amorality amongst different professionals.
Yeah, it must be very discouraging. You're because there is that purity. The intention here is to seek truth, but obviously, that's not the intention.
Correct.
Of a lot of these
Yeah.
Very.
Let me show you viewers one other thing that may be of interest to them. And so the question of we don't have good data anymore about unvaccinated versus vaccinated workers. I said there's no randomized controlled trial that's ever been done, And so here's my Freedom of Information request, requesting that the government produce the evidence that unvaccinated healthcare workers actually caused a problem in terms of infection to staff or hospitals, to staff or patients in hospitals. And so that was my request in February of 2022. And you can see that this is my Freedom of Information request, and I'll show you the actual result of that. And so, can you see this?
Yes.
It says, although a thorough search was conducted, no records were located in response to your request. The ministry indicated they do not hold such specific information and data. Your file is now closed. So when Bonnie Henry comes out and says, I know that unvaccinated healthcare workers can infect staff and patients, what is she actually basing this on? The government has no records. Now, you know, when we introduce a Freedom of Information summary like this, that in fact the government has no data on this, their response would be, Bonnie Henry has access to extra data, and they do not produce, right? And you know, it's based on this, it's based on all the other considerations. So they will spin this, even though this is pretty much black and white, showing that in fact there are no outbreaks caused by the unvaccinated healthcare staff in the hospitals up to the period of February 2022, because
this is astounding.
It is astounding. It is astounding.
Was this pulled up as a document during the case or during
the review? This is part of the record. This is
remarkable. No records were located.
That's correct. That's correct. And so how can she actually say this in public, that it's in fact the opposite, and that the unvaccinated healthcare workers are causing these outbreaks, or she's concerned that they may cause infection throughout the hospital, when in fact you have actually absolutely no evidence of this whatsoever. And so that's what I mean. It's kind of disappointing, especially for the lawyers defending the government. They've seen these Freedom of Information letters. They've seen the data. Mm-hmm. And so I don't know,
what did the opposing lawyers say to this? I mean, how do you even defend this?
Well, they basically ignored a lot of these, piece of information that we put forward. This is probably the best local information in BC, because we don't have a randomized controlled trial. This specifically asks about healthcare workers, the unvaccinated healthcare workers in BC. And so if you have absolutely no records to show that, I don't even, one or two were the cause of any outbreaks, how can you go on and, continue to say that they're a source, they're a source of carrying bugs, they're dirty, they're infectious, don't let them in. It's ridiculous. It really is.
Well, it smells of propaganda. Nothing but propaganda based on no facts, no science.
Right. Yeah.
But it's affected maybe 10,000 people's lives in BC.
Well, it's affected more than 10,000 people, because, it's 10,000 people with families. It's 10,000 people that could be helping thousands of British Columbians. The impact it's enormous. BC currently is the only province in Canada that still has this outrageous things. Nova Scotia previously did, and they changed their tune. They have allowed the unvaccinated healthcare workers to come back, but they have kicked the can down the road, and that they have basically said, well, we're going to leave it up to the hospitals. Even if that happened in BC, that's not a bad idea. I think that some hospitals would be desperate to have healthcare workers come back. I think other hospitals, if they feel that they're flush, with healthcare workers, you want a virtue signal, they want to do these things, go ahead. But I think that even that would be good. Talking about lawyers for a second, I must say that, I have felt that, I certainly have discovered how, and it's an oxymoron, how moral our lawyers are. And then, they have disclosed to me that they have been fighting government overreach for years. They could have chosen to go work for the government, but as I said before, your choices have consequences. At the end of the day, I think they just could not live with themselves if they have to defend a government's overreach, position like this. And so our lawyers,
it's encouraging and it's refreshing to know that lawyers like Peter Gall exist.
Yes. So Peter Gall and his firm, as well as Mark Nora and his firm, are our two legal firms working together to represent us. And they've done a great job.
Well, that is, and they sound like an exception.
I believe so. I believe so.
Well, tell me a little bit more. You are speaking on behalf, or this battle is on behalf of Canadian Society for Science and Ethics, CSSEM. Tell me about how the fundraising is going and what the costs have been for this case, this judicial review.
Great. Thanks again for bringing that forward. This case is the most important case for healthcare in BC. We really are at the tip of the spear. We represent the doctors and the nurses who have been unjustly fired for basically believing in our own autonomy. And so we have been very fortunate to have a very capable team of lawyers who are very expensive, because the other thing that I come to realize is, in fact, you get what you pay for. And the lawyers have capped their fees at $530,000. We're now down to our last $25,000 that we need to raise. And so if any of your viewers feel moved to donate to us, we certainly would appreciate it. Please visit our website, that's cssem.org, where there's a donation portal. And all donations will be gratefully received. Thank you very much.
Well, I think people need to be reminded as well, you're a group of people that have not been working for the last 2.5 years. So you have no income, and yet you're embroiled in this legal battle, which is expensive. And I think you mentioned to me how much the lawyers had said it cost them per day to be in court. Yeah,
I was shocked. They said that one day in court costs $10,000. So we have been in court for 10 days. One day in court costs $20,000. And so we have been in court for 10 days. And so that's $200,000. Now, I imagine that fee covers all of the costs preceding or inclusive of all the prep time that goes into it. But then you actually have the lawyers who are physically sitting there for the entire day. So it's very, very expensive.
Wow. Now, during this judicial review, I think just this week, BC Public Workers launched a suit against the BC government on the issue of vaccine mandates. Do you have any comment on that? I found it to be fascinating that yet another big case. I mean, this is a large one.
Right. Every time someone files a suit now against the government, I cheer them on. Good for you, for standing up and doing something. What the government has done is just, it's complete overreach. And it's very unfortunate that a large number of us did not stand up at the beginning, and then none of this would have gone forward, But nonetheless, it's good that people have now decided to stand up and are coming forward. I wish them well. I know that there are other court cases going on. My only comments would be, it'll be a tough fight. You're up against the government lawyers. They're not going to argue truth. Whatever science you're going to produce, they're going to try and discredit it. you need to be ready for that. It's kind of a roller coaster type of ride, when you're up one moment and then you're down another moment, but there's a lot of emotions going through you. Our case has been predicated on a very, very narrow approach to it, since we were looking for a very small specific target, the issue of reasonableness here, to break this open. Okay, theirs is a class action lawsuit, probably requesting payment of lost wages, etc. We have not requested that. That is going to be a tougher fight, because what you're going to because how the government lawyers will probably interpret that is that they will then take you back not to Omicron, when everything was laid bare, the fact that clearly the vaccines had no benefit, but they will probably take you back to the period of Delta at the very onset of it, when number one, not much information was known, and number two, the early reports regarding Delta, in fact, suggested that vaccination was the way to go. Those were the early reports. And so it's a good fight. It's a tough fight. And I wish them well.
It sounds as though vaccine injury is going to enter into the conversation as well.
I hope so. We did not introduce this, and I know that a number of people who have been following this from the outside, not knowing our case, were disappointed that our lawyers did not introduce this whatsoever. I think the issue of vaccine injury is number one, it's real. Number two, it's very broad. And number three, that's a very tough fight when you're talking about vaccine injuries. But I think that the longer anyone waits before they put forward a case, the better it'll be for them, because it becomes more and more obvious that so many people have been harmed by the vaccines.
Yes. Another question I have for you is the new situation in Texas, with the Attorney General of Texas filing a lawsuit against Pfizer, suggesting that the vaccine was misrepresented, 95% efficacy, when in fact the relative risk reduction was less than 1%. And after the rollout of the vaccine, the death rate went up. Do you have any comment on that? I think this is in the US. I haven't heard of a case like this, but it could be interesting.
Yes, I've heard of this case, and I think that's very interesting. And I think that there are going to be more and more lawsuits against big pharma. This case is interesting because number one, a lot of this data, that Ken Paxton is talking about, that the actual benefits of vaccination was less than 1%, and there are risks related to deaths, is in fact, or has been known ever since the first publication at the end of 2020, in that even though it was known, it probably would take somebody with a little bit more of a medical scientific background to realize that when, let's say, Pfizer was talking about an efficacy of 94%, they were really describing relative risk reduction, which is not what you're going to tell a patient. Relative risk reduction is a comparison of the effectiveness of different vaccines. That's the only time you can really use it. If you have a patient in front of you, and the patient asks a simple question, well, doc, if I take this, what is the benefit to me? That is not a relative risk reduction answer. That is an absolute risk reduction answer. And the absolute risk reduction could have been calculated easily from that paper if you knew how to add and subtract the numbers. The absolute risk reduction in the Pfizer paper was 0.7%. And so I would look him back in the eye and say, Mr. Smith, Mr. Jones, if you decide to take this vaccine, it will increase your risk of not getting COVID by 0.7%. But your risk of not getting COVID only refers to risk of serious COVID. Doesn't talk about you dying from COVID, which is far smaller, right? So that in fact, that's the real number. And in addition to that, there was a lot of fudging of the data as to the number of deaths. There were deaths in the early Pfizer reports, but more and more, there's so much bad evidence coming out about the vaccines, how the vaccine development was rushed. There's contamination with DNA. They had denied it. I think that possibly Health Canada may end up being sued because Health Canada recognized that, in fact, there was DNA contamination, but they said, oh, it's not much. So I think that Health Canada down the road is going to get sued by a bunch of really angry Canadians, and I think they deserve to be sued.
Why is that? Why is that such a problem, having DNA contamination in a vaccine?
Oh, well, number one, no vaccine contains DNA. The DNA makes the spike protein. What Pfizer and all the pharma companies said that their vaccine was based not on DNA, but on RNA. RNA, one copy, only makes one copy of the protein, which is a spike protein. So even though it's toxic by itself because it has your cells manufacturing that spike protein, and the way your body responds to it is that it destroys your own cells, right? And that's how it develops its memory, by destroying your cells that have been making the spike protein. When you have DNA, and your DNA to make the spike protein becomes incorporated into your cells will continue to make spike protein. And as your cells subsequently divide and become daughter cells, they will then continue to make spike protein. And so the issue of autoimmunity comes into this. A lot of autoimmune diseases will be as a result of this. There are a whole bunch of things, especially, from people who may have accepted the government's version that you need a bunch of boosters. Each time you're going to get boosted, you're going to get sick. You're going to get sick, and there's a chance that things will be worse than just getting sick, because there's more and more evidence coming out of how this will affect your overall immunity, your immune tolerance, which allows for autoimmunity, but also the ability to identify, let's say, cancerous cells and destroy it. And now by repeated jabbing, you would have lost this. The idea of turbo cancers, increased mortality, especially in young people. We did not discuss this at all, but this is all in the background. And I think that this is all going to come forward. There's going to be a massive number of lawsuits against government agencies, not only in BC, I think throughout the world. Our government certainly let us down. Both our federal and provincial governments certainly let us down. If they are going to allow the pharma companies to have immunity from prosecution, then they themselves need to be prosecuted.
Well, Canada Health has even acknowledged that they hid this from Canadians.
That's true. That's why I say that Canada Health may get sued.
Yeah, it's so criminal. What do you think the consequence of all of this will be on regular childhood vaccines? Do you think that people are now beginning to feel leery?
Well, I must say that prior to this, I never considered that as an issue. But I would say COVID has now laid bare all of the fact that now that we're looking at vaccinations, let's look at all the vaccinations, and I would say some certain books, such as Turtles All the Way Down, have really opened my eyes as to how childhood vaccines are developed, that they lack a placebo in their controlled trials. And the actual benefits of it is really quite questionable. Can
you explain that? The placebo, there is no placebo. Explain to a layperson, what does that mean?
Okay, so in order for this to be done, typically what you would do is you would do a randomized controlled trial. And so what is being compared is that you'll be comparing your experimental vaccine that you have developed versus a placebo. And the best placebo would be saline. What has happened, and I would say all of the previous childhood vaccines that have been developed, there has never been a comparison against a saline placebo. The comparisons, by and large, when a pharma company wants to say, I've got a new vaccine, they're comparing against the old vaccine. They're calling that the placebo. The old vaccine already has side effects. So if the new vaccine side effects are no worse than the old vaccine, then they're calling it safe.
That's remarkable. I mean, that's fraud.
That's fraud.
But
Well, it is and it isn't. It's only fraud if you get caught, right?
that's
And
remarkable,
so,
though. I don't
correct,
think most
correct.
parents know that.
I bet they don't.
Their
But
child is being injected with something that has never been tested.
never been fully tested. That is correct.
That's remarkable.
And they should go get that book, Turtles All the Way Down.
Have you, if you had grandchildren, would you say to your children, stop?
Well, I do have grandchildren. And
Yes.
I've been trying to tell my son and his wife, you really should reconsider your
Yes.
childhood vaccines and things. But it's always difficult as a grandparent to tell your kids, the parents, and I hope that they will listen to reason. I hope they'll consider it. Because now that's all laid bare. It's shocking. It absolutely is.
Well, every study that I see that's comparing vaccinated to unvaccinated children, especially in some of those unique communities like the Amish, they have no incidence of autism, ADHD, asthma, allergies. The list goes on and on.
It does. It does.
And there's a lot of physicians who have pulled out. The doctor in Oregon, Dr. Paul Allen, is it? Paul?
I think so.
I think so.
Right.
That was a very, very interesting 20-year retrospective study. And the stark contrast between the vaccinated and the unvaccinated patients, children, was remarkable.
Yes. Yes, definitely.
I wish I had not vaccinated my children, but I never even thought about it.
I would say that none of us ever thought about it. We all thought that this was the right thing to do.
Yeah.
Yeah.
Well, and I trusted the nurses, I trusted the doctors, and I guess in some form I was in autopilot. I just never questioned, and I never heard anyone else questioning it.
Right.
But now, no more. I don't think I'll ever have a vaccine again, even for travel. I've taken so many vaccines for travel purposes to third world countries. I will never again. So vaccines to me have been, this whole incident with the COVID era has really destroyed my confidence in all vaccines.
Well, yeah, I think it goes further than that. I think that a lot of people are, they don't trust the doctors anymore, right? As a result of this, certainly don't trust government and a lot of things we do. And, people are just questioning everything, which I think is good. I think it's right. For those who basically say that, please look after me. I'm a good citizen. I'm a good person. I pay you tax money to look after me, to provide for, shelter, a place for me to make a living, this type of thing. That all has been shattered.
Yes. Well, this has been very, very interesting, Dr. Hsiang. I really appreciate your time, and I really hope that you are back in your role as a vascular surgeon at Vancouver General Hospital. I hope that you can resume your position at UBC as a professor of surgery in the medical school at UBC. And I hope that all of you as a group are back working again. And I'm so sorry you all have had to go through this, but I appreciate your time in explaining the intricacies of this judicial review. And I really appreciate your time.
Well, thank you very much. There's nothing more than what our members would rather have than to have the ability to go back to work. I think that, medicine is a calling, and I think that we're not done yet. We want to continue to serve.
Yes. Well, we expect that there'll be a decision made by the judges or the judge in January. What are you expecting?
I'm expecting probably late January.
Okay, we'll be sitting on pins and needles waiting for this outcome. So thank
Right.
you so much. I hope that you have a lovely Christmas, and we'll talk after the decision comes out.
That'd be great.
Yes,
All
that would
right.
be very interesting to do a kind of a final update. So thank you again.
Perfect. Merry Christmas to you and your family.
You too.